medicine physician by trade. I'm also board certified in obesity medicine. Today, as part of Kenyatta College's Wellness Fair, I'm going to be presenting a little bit about COVID-19. It's going to be a little bit of an update. We're quite well aware that by now you're very familiar with COVID-19, especially since it's been over a year since we've all been affected by it. So I'm going to kind of touch on certain things, more like the highlights, give a little bit of historical perspective of COVID in general, and then also touch on some of the newer things that have came about recently in regards to the vaccines, masking changes and policies, and things like that. And there are going to be a couple of polls throughout today, so that way the participants in the audience can actually, get involved and you'd be able to kind of see what other members of Kenyatta College think in terms of how we are doing in terms of this pandemic. So let's go ahead and get started here. So coronavirus, it's actually not a new thing. It's some virus that has been around for over a millennia, and it is a very old virus, but it was recently discovered in the 1960s, and it wasn't really popularized until COVID, really. There are other variations that you may have heard of in the past several years, including MERS and SARS. These were also quite popularized, but not as largely as COVID. COVID is something that was completely new and was considered a lot more dangerous than MERS and SARS. Now, there are other types of coronaviruses that don't cause major respiratory issues. They cause kind of like your regular common cold symptoms. And those are those four types that cause upper respiratory infections that are very similar to, again, your regular common cold. Now, as far as COVID-19 goes, back in December 31st, that's when the World Health Organization was first alerted to an atypical pneumonia that was developing out of Wuhan, China. And that was kind of that first instance where COVID-19 became a thing on our radar. And of course, it wasn't until March 11th that the World Health Organization saw the spread and the amount of infection going across the world where it finally was declared a pandemic. Now, the question I have for everyone is, where do you think we are now? You should be able to participate in this by either going to the link above, or you could even just text, again, that Spencer Wong, that's my name, 307 to 37607. And you can actually put in what you think is going on currently. Are we doing better? Are we doing worse? Or are we currently stable? And I hope this works. That way you can kind of see what other people are thinking. And if it doesn't, we will just go ahead and continue with the presentation. Oh, okay. So we do have some people responding through the chat, and I was going to keep it anonymous, which is why we were doing it through the poll EV. But at the same time, so far we have a couple of people saying that the infection rates are decreasing. Okay. So the link might not be working, so I'm just going to go ahead and move on. The infection rates are actually increasing. Okay. So the World Health Organization just reported that COVID-19 cases are kind of on the rise. For the sixth consecutive week, the new cases are actually at all-time high. And that includes 4 million new cases just in the last week. Now, we're talking about worldwide. We're not talking about USA statistics just yet. The new deaths have increased by 11% compared to the week previous, and that includes over 71,000 new deaths reported. Now, most of these are coming out of hotspots around the world, like Brazil and India, where restrictions have more recently been loosened and people are gathering more in larger groups and not following as much of the hygiene and masking that have been previously discussed. And also, Brazil's a little bit different. Their healthcare system is not as robust. And so we are seeing actually an increase in the infection rates currently. Now, Is the US doing the same? Yeah, we are actually kind of tracking similarly, where we are also having a lot of new cases of COVID, and it's actually on the rise. For instance, this past week, 5% increase compared to the week previous. And in total, 30 million cases of COVID infection since the pandemic began. Now, the good news about it is even though the infection rates are increasing, we're actually doing a lot better with the mortality rate, meaning that there are less deaths now than there were previously. The last week we had 830 deaths per day, and that is considered a considerable drop, 17% drop compared to the week previous. So overall, we're actually doing pretty good in terms of the death rate, much better than we are doing in terms of the infection rate. Now, one of the potential causes for these increased infections and still having a relatively high death rate is these variants that we are now starting to pick up. Here is a table with a summary of the ones that we have been able to find so far, and the list is clearly growing. Now, as far as the information on the variants, we have a minimal amount. You can see here there's a lot of unknowns, right? But the interesting thing about it is some of the variants are more contagious and they also have some ability to evade the current vaccines that we have on the market. Now, that is something that would be really concerning to most people. And it is, because ultimately what that means is if we don't get our entire population, and we're not talking about the United States, we're talking about the world, if we don't get the world population either vaccinated or develop enough of what we call herd immunity, where enough people around the world have been sickened but recovered from COVID-19, then ultimately there may be one day in the near future where there is a COVID-19 variant that our vaccine is not going to be able to manage, and it would cause a brand new pandemic, so to speak. Now, there are different plans to return to normalcy. You've probably heard Dr. Fauci talk a lot about this. But there are three main key things that will help us kind of get back to normal. And that includes masking, testing, and vaccines. So masking, here is another poll. What type of person are you? Are you the type of person that goes extra cautious and wears a double mask? Or do you wear a single mask? Or do you just use a facial covering, a bandana or a balaclava or something like that? Or do you not wear masks because you don't think that they work? What type of person are you? Awesome. So, okay, great. So this poll is working. We have only a couple people chiming in right now, but so far everybody chiming in is saying single mask, and that's absolutely a safe way to approach it. Now, of course, more recently in the news, you may have heard of double masking, and that's just increasing that added layer of material, which provides an additional protective barrier and useful, very, very useful. Now, that being said, a lot of people don't understand how masking actually helps. So the next thing I wanted to show you is a video. And the video is going to kind of give you a better understanding of airflow. Now, airflow doesn't equate directly to viral spread, but when you can see the airflow from somebody's face, it gives you a better idea of how much airflow there is without a mask versus with some type of facial covering versus actual wearing a mask. And so it is actually very helpful to understand why all of these physicians and public health experts keep saying, you got to keep masking, you got to keep masking. So you can see here from this one gentleman, Matthew Staymates, he developed this optical system where he used multiple cameras, multiple lenses to evaluate airflow. It's actually really interesting technology that hasn't really been used before. And we can see that without a mask or minimal amount of facial covering, you're going to be having a lot more significant airflow. And with that, of course, viral particulates and droplets. And so masking is one of the most important ways that we're going to help get back to normalcy because it's going to slow down the risk of transmission. Now, the other component we talked about was testing. Now, you probably heard about testing to death, and there are many, many different types of tests out there. I'm just going to highlight the big three that are currently, happening, and that's the molecular testing, the antigen testing, and the antibody testing. Now, there's many, many differences between those, and if you have specific questions, please feel free to ask them, and we could get to them at the end of the discussion. But in general, a lot of people are familiar with the molecular testing, and that includes the PCR, which is the gold standard of COVID tests, meaning that every other test is kind of evaluated based off of how accurate it is and how sensitive and specific it is compared to the PCR. And so that's one of the tests that is very, very well known and popularized out there. But just to let you know that that type of testing really identifies genetic material from the virus, either DNA or RNA from any different type of virus that we're looking to test for. And that's a little bit different from antigen testing, which really looks at the surface proteins of the virus. And that, of course, is different from antibody testing, which is evaluating a person's immune response and whether they have had an exposure to COVID based off of that immune response. Now, testing itself is becoming more and more widespread and easier to access. Currently up to date, this is gathered from data from 2 days ago from the FDA's website. There are 358 tests in total that are approved by the FDA under what we call emergency use authorization. Now, out of all of those tests, 45 of them are molecular, and there's one antibody test that you can actually do with home collected samples, meaning that you could spit into a cup or collect your own swab at home and bring it in a biohazard bag to the lab. You don't actually have to go to the lab to do the testing itself. And even more useful and more convenient, there are actually prescription home tests where there's one molecular home test that you can get written as a prescription and two antigen tests that you can get written as a prescription. Now that requires seeing a doctor, right? Or a nurse practitioner or a physician assistant or some type of medical professional to write you that prescription. And unfortunately, that is sometimes cumbersome. But even beyond that, there is 4 over-the-counter home antigen tests and 2 over-the-counter home molecular tests now, meaning that you could pick it up over the counter just like you would your Tylenol or your Advil. You just buy it yourself, you don't need a prescription, and you could do testing, whether it is because you're concerned about a potential exposure or you need to travel. Now, that being said, the next part of it is a COVID vaccine. That's how we get back to normalcy. So, have you received your COVID vaccine yet, or do you plan to, or do you not want one? Awesome. Excellent. Excellent. So we got some responses across the board, and it does sound like that even if you haven't gotten your COVID vaccine yet, the majority of our patients want, and our people who are in our panel today, they want to get their COVID vaccine. Now, there are some that are responding back that they don't want to, and that's okay. We want to educate about why it's beneficial, but everybody has their own preference. And as long as you have a education and an understanding of how a vaccine works, and you still believe that it's not the best thing for you to get or for your family, that's okay. But I do want to talk a little bit about vaccines because it has been in the news very recent. Now, there are technically three vaccines currently being administered in the United States. That includes one made by Pfizer, one made by Moderna, and one made by Johnson and Johnson. And one of the reasons why we wanted to talk about vaccines today is because Johnson and Johnson had recently made the news for having to put their vaccine on pause in the United States within this past day. And that was due to a risk of thromboses or clots that are forming. Now, if you look at this chart, there are a little bit of differences between the vaccines that are offered in the United States and the one that isn't, which is the AstraZeneca. Now you can see that the two types that are most commonly talked about, the Pfizer and the Moderna, these have very, very high efficacy, meaning that they work very well, but they do usually require two doses some time frame apart, and they also require different storage capabilities, meaning that you have to have a very, very cool, deep freezer to manage these vaccines. And that is sometimes not capable of being done in third world countries, which is why a lot of other countries use and rely on AstraZeneca and the Johnson and Johnson, which you could just refrigerate at a standard refrigeration temperature. Now, there's also cost differences between the vaccine. You can imagine that requiring specialized freezer equipment, the vaccine is probably going to be also more expensive. Now, that being said, the biggest difference is the way that the vaccines are administered. The Pfizer and the Moderna are mRNA vaccines, and the AstraZeneca and Johnson are these adenovirus vector vaccines. Now, why is that important? Well, Johnson and AstraZeneca both have had this similar finding where they are promoting something called VIT, which stands for Vaccine-Induced Immune Thrombotic Thrombocytopenia. If we break down this large term, vaccine-induced means that we are finding that these causes and symptoms are being caused by the vaccine itself. Now, the immune portion means that it is your immune system that is related to it. And thrombotic means that it is forming clots, thrombosis in your system. Thrombocytopenia means that you're having very low platelet levels. So what essentially is happening is in some of the patients that are receiving the J&J and AstraZeneca vaccine, they're forming clots randomly within their body. And not only are they forming clots, the clots are using up so much of the clotting factors and the clotting supplies like the platelets that eventually it leads to low platelet levels, the thrombocytopenia, and that leads to bleeding. So it's a very interesting phenomenon where you first have clotting and then you have bleeding after that. And the working theory is this is somewhat related to possibly the adenovirus vector mechanism and the immune complexes that are formed because of it. Now, this is happening in 1.1 out of 100,000 people who get vaccinated. So it's extremely low. Just to put it into perspective, AstraZeneca is primarily used in European countries right now. And out of 34 million people in those European countries that have been vaccinated, only 222 cases of thrombosis have been reported. If you do the math on that, that equivalates to approximately 0.00006% risk. Okay. Now, does that mean that you shouldn't get the J&J vaccine or the AstraZeneca vaccine? No, it just means that you have to assess the risks and benefits of this particular vaccine. Luckily, in the United States, you have options, right? So the highest risk patients for getting this type of VIT or the vaccine-induced immune thrombocytic thrombocytopenia is in 35-year-old females. And so with that being said, if you are within that 30-year-old range and you are a female and at risk for thromboses, we would recommend for you to focus more on the Moderna and the Pfizer vaccines. But let's say you are a 60-year-old male. Well, now your risk is actually higher for catching COVID, and your risk of dying from COVID is a lot higher than that 35-year-old female. And when you catch COVID, your risk of clotting is about 16% versus 0.00006% with the vaccine. So for somebody who is a 50 or 60-year-old male, it might be worth the risk of getting some clots instead. So maybe get that vaccine. The J&J vaccine would be worthwhile. Now, looking ahead, you know, Kenyatta College may start to participate as a vaccination site, but the main goal is getting some of our county clinics and also, increasing the amount of these large vaccination, things that they're doing, like at the Levi Stadium and Oakland Coliseum, getting those to open up more to our community. But eventually, what we're thinking is we're hoping that even our college campuses can be a vaccination center and help with vaccinating people with COVID. Okay. Now, the county is hoping to reopen in San Mateo, and more of the services are going to be available to people. And in terms of that, that also means a lot of our students returning back to campus, and the whole country and world in general going back to normalcy. Now, post-COVID reopening, how is that going to affect us specifically at Kenyatta College and maybe the Wellness Center? Well, we're looking at potentially an increased mental and physical health, in terms of patients coming in, because a lot of the depression and mental health, problems that people have been dealing with have not really been addressed. And COVID itself has been putting in a lot of social isolation, which has been worsening mental health. And so we are expecting a large influx of these types of cases. And we saw this when we had a lot of lockdown from that first COVID surge. And then, of course, you had some reopenings and then another surge and then more reopenings. And so this back and forth, we've actually seen already a lot of that cases of mental health and even physical health that wasn't addressed previously due to fear of COVID. Now, as far as Kenyatta College goes, we probably will continue to primarily hold classes with distant learning until we get more and more of the community either vaccinated or developing herd immunity. Okay. So that's pretty much it. Are there any questions from anybody in terms of out there as the audience with this webinar? We could go ahead and try and address them right now. No? Okay. So I don't see any activity in either the Q&A section or the chat. And if that is the case and there are no questions, I wish you all a great rest of the day. And for those of you who were just